Okay, so everyone, we are at the sort of information stage in our new Unsheltered Homelessness and Encampment Health and Housing Services RFP. I think I see some familiar faces who maybe joined us in the engagement process. This presentation today is specifically for folks who might be interested in either learning more about this funding opportunity, or maybe you are already aware that this is in alignment with the work that you all do, and just want to get some more information about how to best prepare your application. So that's essentially what our objectives are for our time together over the next hour. I want to also real quick introduce my colleague, Kelsey. She is also an integral person to the COC process. Kelsey, if you wouldn't mind just introducing yourself real quick, name, pronouns, and role.
Hi all, Kelsey Beckmeyer, she, her pronouns, and I'm a program performance manager with the RHA, and along with Jen, helping to co-lead the NOFO process, which includes the special NOFO, or SNOFO, as we adoringly call it.
Awesome. Thank you, Kelsey. So yeah, the three of us are the ones, Eric, Kelsey, and myself, who interact the most with the COC bodies of work. So just want to make sure you know who we are. Real quick, Em, do you mind introducing yourself too? Em is another colleague in our information session today.
Hey all, my name is Em. I use she, her pronouns. I am a program specialist with the emergency services team. So I do a lot of work with folks in shelters, outreach, and day centers, and then hopefully soon to be safe lots. So happy to be here. Thank you, team, for this brilliant work, because it's a lot of work and a lot of brilliance here. Thank you.
Awesome. Thank you, Em. All right. So moving along in giving an overview, this might be familiar to folks that were able to attend the previous sessions related to this fund source. But this is a one-of-a-kind HUD funding opportunity. Folks who've been interacting with HUD funds for a while are probably familiar that typically they just tend to put out renewal and sort of bonus funds related to COC funding opportunities, but this is a brand new fund source for HUD. They've basically reallocated some of the underspend nationally to create this specific sort of special, like Kelsey mentioned, special NOFO or SNOFO, as we endearingly call it, to specifically address unsheltered homelessness, and rural homelessness as well, but because of the region in which we live, we actually do not classify as rural, so we don't have access to the rural strategy that's involved in this competitive process. Want to make sure that's just really clear. That's nothing that KCRHA has say over. That's sort of a HUD distinction and HUD rule. So KCRHA will be competing for the unsheltered portion of this NOFO in collaboration with hopefully all of you all, or anyone who's interested in moving forward with the application. So what is this thing? So HUD has released these funds specifically with the intention of investing in more programs that are grounded in true sort of fidelity-based housing first models. So want to emphasize, if you look through HUD's publications, they really want to award funds to those organizations or COCs who are doing housing first correctly. And I want to highlight that because as you all know, there's many different ways of potentially, doing housing first work, but they want to ensure that it's done correctly as defined by HUD. So I highlight that because I urge you to check that out and make sure that's in alignment with how you, kind of see and envision your programs working, and see if that's going to work or not for you. If you can speak to how you do housing first work in alignment with HUD's definition, I believe your applications will be most competitive competitive. So want to highlight that. They also emphasize the importance of integrating public health principles as well. They don't give a specific definition of what that looks like, but any kind of interaction that you may have with other systems to address public health, sort of the range of public health, including behavioral health, physical health, and sort of just the holistic aspect of health as humans need, will serve well in this funding opportunity. Our region, and this is again dictated by HUD, has the opportunity to secure up to $14.1 million over a 3-year period, which equals to about $4.7 million annually. It's a little bit, this opportunity is a little bit different than usual in that they are going to make a 3-year award. So it will be whatever awards we receive as a COC will be granted by HUD for a 3-year term. And then we believe that, the intention is that funds will remain sustainable and sort of geared towards the long-term vision. Of course, depending on, Congress and budgets and things like that, and also performance, but that's sort of the intention as we understand it. So HUD will be awarding these funds to continuums of care nationally. So KCRHA is the Seattle King County new leader within our area. So we will be preparing this application on behalf of the Seattle King County Continuum of Care. Our first sort of step within that is this local application, this local RFP. I'll get into sort of the ins and outs of that, but just wanted to share that we will, kind of similar to the renewal and bonus funds process, we'll be starting with an RFP, rating and ranking those projects, and then submitting the final application to HUD as a COC. Again, the purpose of this fund source is for new programs. So it doesn't have to be new agencies. If you're an existing agency who is currently funded by COC funds, that is fine, as long as the program that you are proposing is new and doesn't currently have COC funds attached. With the goal to reduce prevalence of unsheltered homelessness, improve coordinated services, health outcomes, and housing stability among unsheltered individuals and families. So it's open to both single adults and youth and young adults and families as well. Partnerships with health and other housing agencies to leverage mainstream housing and healthcare resources will score the highest and be the most competitive. So this funding opportunity really emphasizes the importance of leveraging. So if you have those existing partnerships or you're able to secure those partnerships with the help of this funding, we highly recommend submitting your applications, and definitely highlight the ways in which you are creatively leveraging existing resources in our community to improve health and housing outcomes. And we'll take questions at the end. So if things come up as I'm going over this, please feel free to write it down or hang on a second, and we'll get to your questions at the end. So some of the additional priorities related to this funding opportunity, ensuring unsheltered individuals, including people who might be staying at encampments, are successfully connected to healthcare and housing resources using a housing first and public health principles. Continue, if you're not already, continue to gather and input data into HMIS. That is a requirement to be a recipient of these funds. Demonstrate an interest and ability to collaborate and coordinate with multiple services and multiple systems and service organizations. So if you have that in place, highly recommend emphasizing that and the ways in which that works for the program you might be proposing. Ensure individuals, so I'm really proud of HUD. I think we are, as an organization, are proud of HUD for emphasizing these priorities kind of within their funding as of lately. So ensuring individuals with lived experience of homelessness are included in the operations and program design being proposed. So think about the ways in which you currently or could potentially involve those with lived expertise in your program development. Definitely want to talk about that. If you're not already doing that, definitely urge you to consider how that might work for your organization. You will definitely be most competitive if you're able to speak to that. In addition to the ways in which you might advance equity for Black, Indigenous, and other people of color, as well as individuals who identify as LGBTQ+ and individuals with disabilities. So again, if you're able to address how you are actively as an organization and specifically this program working to address equity, again, you will be most competitive. Services shall be offered across Seattle and King County, so it's not Seattle centric. This is county-wide opportunity. So who can apply? Applicant eligibility, again, within King County. So we can't, because it's specific to our COC, we cannot award funds to entities that are outside of King County. So King County is a must and would include government agencies, public housing agencies or public housing authorities, private nonprofit organizations, faith-based organizations, federally recognized or Washington state recognized Indian tribes, or community mental health associations that are public nonprofit organizations. Those excluded are going to be for-profit entities, which is a little bit different than some of our other funding opportunities, which may be open to for-profit corporations for development projects and kind of capital projects, things like that. That criteria, though, is excluded from this funding opportunity. So program participant eligibility. All program participants must meet HUD's definition of literally homeless or chronically homeless. And you'll want to be specific on sort of the numbers served and how folks identify as far as the definition of their experience with homelessness when you are completing your application. So literally homeless, chronically homeless, or program participants who are fleeing or attempting to flee domestic violence, sexual assault, including sex trafficking, dating violence, or stalking are also eligible for this funding. We also encourage, based off of the community engagement leading up to the release of this RFP, folks had a lot of really incredibly creative ideas, especially identified some communities and populations within our region who are unfortunately really underserved and kind of meet the nexus of what this RFP is trying to accomplish as far as housing and improved health outcomes. So we highly encourage you to think creatively, kind of think outside the box, especially if you're serving communities who we know are underserved in both housing and health systems. Some ideas that came up from some of our community engagements were people experiencing homelessness who are also pregnant or have newborn young children. That seems to be a big gap in an area where both health and housing outcomes could overlap really well for this for a proposal for this funding opportunity. Culturally relevant wraparound services, so thinking about health and the ways in which culturally different health programs and health delivery may look different. Health delivery services or behavioral health services may look different in different cultural contexts. May be a great proposal to put forth. Permanent supportive housing for elders. So just kind of thinking outside the box if you can. We highly encourage some creativity with this new body of funds entering our community potentially. So program scope and eligible activities. So again, this is kind of dictated by HUD. There was one component that we decided not to write into this RFP based off of the engagement that we did leading up to it, which was the outreach component. We felt like we would probably do better strategically as a COC in trying to gear more towards these eligible activities of permanent supportive housing, either scattered site or project-based, and then the various different components within a permanent supportive housing project. So you can request funds for permanent supportive housing, operations, support services, rental assistance, or long-term leasing, or sort of all of the above, right? So if you have, let's say, for example, a program that you've already secured funding for the support services on site to make your permanent supportive housing program whole, but you don't quite have the subsidy for the units, you can apply for the rental assistance and long-term leasing part of the components only, or vice versa. If you already have the funding figured out for the units, but you're not sure what services, you can also apply for services only through this RFP. Hopefully that makes sense. Wanted to have some flexibility there. The other eligible activity is any new joint transitional housing and rapid rehousing program. So again, the definitions are in the RFP a little bit further as far as laying out what is eligible and ineligible. It has to be new. They have to be new programs. And then HUD is also a great resource as well if you're not totally sure with what those program models are. So definitely encourage you to check those out as well. So some ineligible activities within those two different program areas. Again, check out the RFP for more information, but did want to highlight that hard costs, so your capital improvements and things like that, are not eligible for this RFP. Also ineligible are projects that are currently funded through COC, other COC projects. You can't blend other COC money with something that you might be proposing for this RFP. It has to be a brand new project not currently funded by HUD COC funds. So this is kind of going back to what I just mentioned before. For the permanent supportive housing proposals, you can apply as a standalone program, but applicants must, in your application, fund support services to ensure sort of program fidelity of the permanent supportive housing model, right? So it needs to have some level of care associated with it. Given the program model and sort of the population that permanent supportive housing tends to serve. So applicant requirements, in order to successfully contract and be awarded these funds, we do ask that all applicants are open to and ready to participate in HMIS data entry and keep that updated and ongoing. Participation within the Seattle-King County Coordinated Entry System is also a requirement, and or the Domestic Violence Coordinated Housing Access Point, which is the system specific to survivors of domestic violence, sexual assault, or trafficking, and housing resources that are available. Must follow the current King County Public Health COVID-19 safety guidelines for any housing programs. This is a tricky one. This is a HUD requirement, so there is a 25% match that is required. So 25% of whatever your budget ask is required for all COC recipients. And please make sure to be explicit in your budgets. There is a specific COC related budget template that goes along with this application. So hopefully it's clear and explicit, but we will have a lot of questions if that is not explicit in your proposal. And then also, I would recommend getting started on these right now if you haven't already, if you do plan to move forward with submitting an application. You will be required to let us know what your unique entity identifier or UEI number is. It used to be called the DUNS number, but HUD has now replaced it with this UEI number. So definitely make sure you you could Google that, get the number before your application is submitted, because we will ask you for that number on your application, as well as your SAM number, the Federal System for Award Management Registration. So both numbers should have, be in good standing and have access to those prior to submitting your application. Some additional requirements for our applicants. If you are planning to use some of your replacement reserves as part of your budget, please make sure that you include supporting documentation of how you plan to use that for your operating. If you also have a federally approved indirect cost rate, please also include verification of that and include how much that indirect rate is for your organization. If you don't have one, it's probably too late, to be honest, if you're not familiar with what that is. It does take a little bit of time to get approved for one. Yeah, if you have one, great. If not, we'll just provide the standard indirect cost rate. Commitment to continuous quality improvement in coordination with the LEC. So the LEC is the Lived Experience Coalition, which is a governing body of the King County Regional Homelessness Authority. And we do require that any successful applicant who moves forward with contracting with these funds with KCRHA engages in continuous quality improvement, which will probably look like surveys that go out to participants receiving services through the proposed program and are reported kind of back to the LEC. More information again is in the RFP. All right, so when it comes to the application portion, what I just went over is sort of the ins and outs of the funding opportunity. Now, kind of transitioning a little bit to what you need to know when it comes to completing the application. So one application will be required for each program type that you anticipate applying for. So if you plan to apply for both permanent supportive housing project as well as the transitional to rapid rehousing joint component housing model, then you would have two separate applications and two separate budgets for each. If you only plan on applying for one, you would complete one application. Applications will be rated based on information requested in the application, a financial review, also the submission of the supplemental documents, and any clarifying information that may be requested by us sort of after the completion of your application once we get to the rating panel. If there are any additional questions that may arise from the rating panel, we would be in conversation with applicants about those. So for this application, and hopefully this is not new to all of you, we are using Smartsheets again. This is a platform that we use for the renewal and bonus processes versus Flux. So if you've applied to any of our other non-COC related RFPs, we've used Flux, but this one we're going to use Smartsheets. I want to just highlight a couple things, and Elaine, I'll get to you in just a second. I saw your hand, but I want to make sure we get through this important piece because I am a grant writer as well, and this would be incredibly frustrating. The Smartsheet application cannot be saved as. You have to complete it all at once. So I'd hate for folks to get like halfway through or more than, and then, get distracted or be done for the day and then lose all your work and trying to log back in. So it has to be completed all at once. That said, we'd advise that you kind of use the RFP that's published, RFP and application, as kind of like a desk reference, and then maybe start your application on a Word document, or collaboratively work on a separate document and input it into the Smart Sheet when you know for sure that you'll be able to submit everything all at once. So hopefully that makes sense. Thank you in advance. We are working through our kinks with Flux. So thank you in advance for your kind of patience and work around with our Smart Sheet application process. Applications are due on September 20th before midnight, so 11:59 is the cutoff. Want to highlight, because this can obviously take some time, if you are proposing any major partnerships, especially important if you are, some of your match is in kind, to include signed MOAs or MOUs outlining the partnership that you're proposing. And more specifics are included in the application portion of the RFP guidelines and application that outline what needs to be entailed in your MOU or MOA. There are some specific requirements in that based off of HUD's requirements as well. Be sure to complete the COC specific budget template. It looks a little bit different than our KCRHA's regular budget template. A budget will need to be completed for each project that you are proposing. So if you're proposing multiple, we'll need one for each. And then be sure to submit all required supplemental documents with your application as well. We didn't put a word or character limit on this, so please keep in mind that we do have a team of raters, a community-based rating panel that is also working within this very tight timeline. So if you can keep your answers concise and clear, that's going to help everybody out and will help to get your vision across easier. All right, so as far as timeline, actually, let me pause right here. Elaine, you did have a hand up. Okay. Go ahead and unmute if you can. I want to take your question.
Oh, that hand was a mistake. Please disregard.
Oh,
thank you.
Okay. Hey, just kidding. So timeline, back to timeline. Again, we thank you all and apologize at the same time for this really, really quick turnaround. As we all know, HUD put out the renewal and the bonus NOFO pretty much the same time as we are all now kind of scrambling to ensure that we can be successful in competing for this special NOFO. So the timeline is tight, and we acknowledge that. So we released the RFP on the 31st. Today is the webinar information session. We will have questions and answers that will be publicly posted on our website. We're going to clean up the website a little bit, so keep an eye on the funding opportunities tab of our website. We're going to move kind of everything up there today, and then that is also the section in which you'll find the ongoing Q&A for this RFP. So the last day to submit your questions, and you'll submit your questions to coc.questions@kcrha.org. I'll have that also posted on our last slide. So for folks who are visual, you can see that there. Pose any questions you have about the application by the 14th, and we'll be sure to get back to you within 24 hours, and then also make the Q&A public. So if you also have the same question, you can look back there as reference. Again, all applications are due September 20th before midnight. The rating and ranking process will occur pretty much immediately after that. We'll have a team of raters that are community-based folks reviewing applications, and then they will put forth a rating and ranking order to the full COC committee on October 5th. We will also notify all applicants of whether or not folks were rated high enough to be ranked in the overall COC HUD consolidated application that KCRHA will put forth to HUD. So again, an important deadline or important date is you will be notified by the 5th of October of the outcome of your application. KCRHA will then submit the final consolidated application with ranking order to HUD by, our goal is by the 18th. The hard deadline is the 20th for us. So just so you know, we're giving ourselves a couple days. We also encourage you to do the same when you're looking at the September 20th deadline, just to make sure, you know, you're prepared for any kind of technical kinks or anything like that. So we do the same thing and giving ourselves a little cushion there. HUD is expected to make their final COC award announcements sometime in late 2023. So we'll keep you all posted as we are updated with more specifics, but that's sort of what you can expect. Let me think if there's anything else. So I just want to explain a little bit for folks who might be new to the COC kind of RFP process. The way the process works is once we receive your RFP applications on the 20th, we will forward your applications to a body of raters who will read applications and rate based off of the criteria that's listed in the RFP. So you'll see the criteria in the RFP. That's a good strategic way to think about how to best answer and how to best interpret the priorities of this RFP. Once raters score each applicant, then we convene and have a conversation in which a ranking is determined, and this is a little bit different. Oh, but I see a typo there. Rating and ranking, not ranting. Sorry about that. The rating process is a little bit different than sort of the typical RFP that we would see. That's just maybe with general fund dollars or non-federal fund dollars. What the ranking is literally like 1 through however many applicants. 1 would be sort of the top proposer or top proposal that we're putting forth to HUD. And then HUD will look at sort of the ranking order and make funding based off of what is available for the region and how well they decide as far as what they want to invest in or not. So it is possible that if your proposal makes the ranking order, it is possible that when it gets reviewed by HUD, that they may not necessarily fund all of the organizations in ranking order. It could just be like the top 5 or the top 10 or whatever. So final awards from KCRHA are very much so contingent upon the final awards that HUD will make to the Seattle-King County continuum of care. And we won't know that until late 2023. So the notification that folks receive on October 5th is again, a notification that your application will be moving forward in the process, but it's not necessarily an award at that point because KCRHA doesn't technically have the funds until the COC awards are made in 2023. So I hope that makes sense. It's a little bit different process than kind of the usual RFP. So I know there's some questions in the chat, which is great. I want to give this as a visual for folks. That's where you can pose your questions, coc.questions@kcrha.org. And we have a little bit under half an hour for any Q&A. So what are your questions? Any questions? Feel free to unmute. Kelsey, anything you want to highlight that was discussed in the chat that folks may have missed?
You caught me right as I took a bite.
Of course.
I think we've talked about most of the things in the chat. I think the couple things that I do want to highlight is that the application types based upon community engagements are limited to permanent housing, permanent supportive housing, and joint components of transitional housing and rapid rehousing. Those were the two types that were really elevated in the community to be the types that we have. So if you are working within one of those types, you are eligible to apply, and you can apply for the various allowed expense components. So supportive services, operations, rental assistance, but it has to be within those two project types. The other thing that I think came up to highlight is for any organization that provides support services, you can apply if those support services are provided in tandem with a program of the PSH type or the joint component transitional housing, rapid rehousing type. And there needs to be a formal agreement and partnership with that. So for example, if your agency provides the supportive services to a permanent supportive housing building, you can apply to provide support services, but we do need to see that partnership between the permanent supportive housing entity and the support services entity that demonstrates that clear relationship. I think those were the two things that I wanted to really highlight. There's also a question here from Elaine around the final rankings public. Those will be public after they are voted on by the advisory committee, which will be in October. We have to inform everyone of their approved or rejected status 15 days before the HUD deadline of October 20th, so that October 5th deadline is our deadline to inform everyone. That will likely also be the date where the rank order is posted, and that will be posted online. Any other questions?
John.
I have a question.
Yes.
Can you go over the HUD healthy housing principles?
Yes, I don't have them memorized. Let me look. Any other questions while I pull this up? And Akila, just curious what the context is kind of for your questions. Is that kind of related to the public health component of this RFP? Or where were you going with this? I'm just curious so I can better answer.
Because I know that you said that you have to be, like the provider has to be in line with the healthy housing principle.
So good, I'm glad you asked. So HUD doesn't really have like a definition. They want their intention with this investment is the nexus of permanent housing and improving health outcomes, right? So they have using a housing first approach. So they have a very literal definition of housing first. So I encourage everybody to make sure you check that out and make sure that your program that you have in mind really does align with that, because they made an emphasis on correctly sort of the key term there, implementing housing first. So I think they are seeing that there's sort of different interpretations of what that means. And maybe folks say it's housing first, but then when you see exits or termination of program participants, it doesn't really actually align with housing first principles. So check that out. And then the public health piece, Akila, they don't really have a whole lot of tangible or direct definitions of what that means. So I think like the takeaway there, because I did some research myself too, like what exactly do they mean by that? is the whatever would constitute improvement of health outcomes for participants. I think would embody kind of what they mean. It doesn't necessarily have to be the the 6 healthy housing principles, but I mean that's a priority of theirs and it's important as well. So if you do have a program or someone has a program that kind of is in alignment with those, I'm sure it would not hurt, but it's not a requirement necessarily to have like the healthy homes framework included.
So if a provider needs funding for like behavior health funding, is that something that they could go in for?
No. So this RFP does not provide funding for behavioral health services outside of, it's really about leveraging, right? You'll be most competitive if you're able to explain how you're able to leverage some of those behavioral health services. But what this RFP could pay for is if you're proposing a permanent supportive housing model, it could pay for the case management, clinical case management. It could pay for the housing search component, whatever components that might be supportive within the permanent supportive housing type of model. That makes sense.
Thank you. Yeah, that does.
Mhm.
Thank you so much.
Okay, of course. And similar for the joint component as well. When it comes to the support services linked to it. Any other questions? Also feel free to put it in the chat. Thank you, Kelsey, for responding. Anything you want to highlight, Kelsey? I'm kind of not paying attention to the chat, so.
Yeah, so there is a question about different program models that describe operations and services separately. This is a pretty common model nationally where the PSH operations and building maintenance is done by one organization and then support services are provided by another organization. This is also something with scattered site PSH models where rental assistance may be offered by one entity and then the support services are done with another organization who does the outreach and support services. That's quite common with scattered site models of permanent supportive housing, which is much more common on the East Coast than it is on the West Coast. And I can find and look for some other specific examples of programs, but you'll see that in quite a few permanent supportive housing throughout the nation. And then there was a question around activities that are not eligible. That one is a meatier one to ask. I will post all of the eligible activity information for COC dollars in the chat. There's a link that lists all of the activities that are eligible. Non-eligible ones, it's really case by case and depends upon which component you are applying for and what you ask for. If you don't ask for a component and activity, those will not be allowed expenses or eligible expenses. So it can be a little tricky depending upon your budget. But I will post that link so you can read a little more thoroughly about allowed expenses and eligible activities.
And I would say, if I could just add, like the hard no for this RFP is capital expenditures are not allowed. They are allowed for the rural initiative. So if you've seen that on some of the HUD information, it can be confusing, but it's not allowed for the unsheltered. Awesome. Elaine?
Hi there.
Hey.
So considering that this timeline is so short, do you have any suggestions for, or guidance for writing a strong RFP in such a short time period, considering that this is a pretty long application?
Yes, I know. Again, in this together. It's not ideal. I absolutely recognize that. That's not how we will go about our work when we have more flexibility and not sort of dictated by the fund source as much. So sorry. Guidance recommendations, we tried to, it's going to look a little bit different like when you're looking at the guidelines and application on the PDF that's on our website versus in the smart sheets. We tried to do as much sort of check the box, as we could on the applications versus tons of heavy narrative. I mean, there is some narrative for sure, but we tried to kind of simplify things that way for folks as best as we could. Excuse me, as best as we could. There's also just a lot of HUD-driven questions that HUD requires us to report back in that consolidated application. So some of the information is just sort of out of our hands, unfortunately. When it comes to the narrative pieces, if you are able to focus on how your program does housing first, how it does it to the sort of its fidelity model based off of HUD's definition, that's going to be most competitive. If your program is proposing to work with BIPOC communities living with disabilities, or any other marginalized communities or populations, definitely would be explicit about that and how you do that. And if you do that well, that's going to be helpful. Also, the priority of having folks with lived experience hold some of the power within your programs and your organizations, meaning having control over some of the operations, the policies, the board or governing leadership bodies. If you can speak to that, that would also be helpful in your application. Anything else, Kelsey, that you want to add? And then we'll get to you, Tina.
I would just really emphasize that, moving forward, a huge tenet that we'll be looking for procurement purposes is looking at power sharing with those with lived experience. So really thinking thoughtfully in the long term with organizations and boards particularly about who are on those boards and who is invited to participate and whose voices are elevated. That's something that really aligns strongly with our theory of change about ensuring that the voices of those with lived experience are at the center of all of our work. So just want to highlight that and really encourage some thoughtfulness around what boards of directors look like.
Yeah, thank you, Kelsey. And also to go back to that creativity piece, if you have an application or if you have a proposal that is creative in how you're leveraging our community resources, I think that's a huge emphasis of HUD's priority here and of ours, is how you're able to collaborate and leverage and maximize sort of the resources related to health and housing for folks who are currently unsheltered. Tina.
Yeah, could you speak more to what you guys identify as that power sharing? I just think that there's some people with lived experience who have lived experience who have been out of the life for a long period of time, and then there's people who are currently or yesterday, and their information might be, we don't want any rules. Right. So what's your vision of that inclusion that's, for lack of a better word, inclusive, but also realistic?
I mean, I would say, and this could be a whole discussion, I think, of everybody here. Authenticity, it's not tokenizing folks. It's really right. Meeting folks where they're at, like you mentioned, somebody may be, years out of their experience with homelessness and be in a place where the trauma is healed enough to be able to participate in these ways. And then there may be folks that are still very much so traumatized by the experience and may not be able to. And we shouldn't make any of those assumptions on where folks are at. But having an avenue to authentically lift up the expertise, that folks who have lived experience, like not making decisions for us without us kind of approach. That's a kind of a quote that I have really learned to embrace and believe in. Is sharing the power, sharing that power authentically and not in a tokenizing way just to get points on an RFP, to be honest.
So would you say it's similar to like years ago, I was a school counselor and so I like including youth in youth programming input and things like that. But, also understanding developmentally and all those things, like what that means. And I just want to call out, the reason I asked the question is something you pointed out, which is the re-traumatization and tokenism. So like, because ethically, I'm just significantly opposed to that. I've seen it happen where people have been re-traumatized because they're just not ready. And that's okay. Like, we have to be okay with some people's experiences not being in that place yet, right? And so, I mean, I've met with lots of people from the RAP program, the resident advisory folks, and they're lovely, and they have really cool ideas that we've incorporated and things. So sometimes the lived experience might be people who we currently house, but it also might be outside of where we are currently housing, right? And that's okay as well, correct?
That is okay. Yeah, I would just speak your truth as an organization, kind of where you're at. There's some that may not quite be there yet. Right. Yeah. Yeah.
Or
sort of
a blend of all of it.
Right. Exactly. Sort of the spectrum of it and kind of where you're at. If that is a priority that you as an organization can align with, and maybe you have areas that you've identified to improve, I would encourage you to speak about that. That's going to serve you well in the application. And I think, it becomes apparent to folks who are reading the applications when something is authentic and not. So yeah, I would just speak to how you're doing the work. And if this is something new, a new priority to you, then speak to how you plan to do so.
And I just want, because we also look at hiring people like with different experiences, different positions. But then also for us, obviously, homelessness is a critical piece, but there's also a lot of people we include in which have lived in extreme and generational poverty. And the only reason why they haven't been homeless is because of being able to live in housing that was helping to prevent that. So, so hopefully there'll be space in the application to also look at, how are we not creating traumatization by making people have to become chronically homeless to get services and housing. So I'm glad this application includes literally homeless because forcing people into chronicness, right? And so, oh, good. Thank you so much for that clarification. I appreciate it.
Thank you for that question. And I hope we can have more conversation as a community around, how to continue to improve upon leaning on expertise without traumatizing. Anne and then John.
Okay. Thanks all. I just wanted to piggyback on what Tina was asking and just thank you for asking that question. And I just think that this is to get to do with this, but I also just, since we're bringing it up, I just wanted to say, I think KCRHA could really do some good work with organizations that don't have a lot of familiarity or experience with knowing how to include their folks in that power sharing and decision making and getting their ideas. And I think that's really an avenue. I know things are super crazy right now, but an avenue that I think organizations who really do want to be more housing first minded, be more aware of those with lived experience and how to incorporate those things. I think there's just some education and some knowledge that could really be useful for organizations that are trying to make those changes, but are not sure what are the specifics and logistically, what does that look like? And how do you do that in a respectful and non-traumatizing way? So I just wanted to say yes, and more of it. So thank you.
Thank you. Yeah, no, thanks for saying that. And we have a whole capacity building team, which I think is so amazing structurally as an organization that KCRHA has built in. So we'll bring that, we'll bring your comments back, Anne. And I think it's a great area for that team to help us as a community kind of think through and move through and continue to build upon and get better at, all of us, I think, as organizations. So thank you. John?
Hi, thank you. I had a question. I hate to go back to the program model question, but I think I wasn't being specific enough. And I was wondering if you could help us understand. We have a number of properties that do combine behavioral health services with permanent supportive housing. And I think I just had a question about the intersection between PSH and public health. And I think my question is this NOFA specific towards creating a partnership with like a medical provider like Harborview and permanent supportive housing, or is this still, the model that I think we all understand, which is, connecting behavioral health services to our permanent supportive housing? So I think that piece is what I'm trying to get some clarification on. Thank you.
Thank you, John. Great question. So I would say yes to both. Yes. So the way HUD is defining sort of public health and health outcomes is all encompassing of both physical health and behavioral mental health. So I think, and sort of in the essence of the power of leveraging resources, if you do have those connections with Harborview or a behavioral health provider, Medicaid, Medicare, those will all help to make your application even more competitive. So definitely speak to those partnerships. That's a huge component, and you can look at how the application kind of like type. What is my? I'm losing my words. The application questions, they're sort of categorized on, like program type, racial equity, budget. The different sections within the application are scored differently and sort of weighted accordingly. So you'll see that the partnership pieces are weighted very high. Racial equity rated high, to align with both KCRHA's priorities and the priorities of this NOFO, because we need to be able to be competitive as a COC so we can secure those dollars for the Seattle-King County COC, because we're competing with all COCs nationally when we put forth our rating and recommendations. Did that answer your question, John?
Yes, thank you very much.
Okay, cool. Also, just in that kind of along the same lines, public housing authorities. So vouchers are another great resource to leverage as well. We encourage that to help offset the cost of the housing components of your programs, and then any other community based, health or other, support service, vocational health insurance, those types of things. If you can speak to that, will be really helpful to your application success. So we are a little bit over time. Thank you for the additional 2 minutes. Appreciate you all. We will go ahead and get this posted on our website. Stay tuned. We're going to clean up the funding opportunities section of our website, and that's where the Q&A will be posted. If any other questions come to mind as you start to digest this information and hopefully dive into your applications. Again, don't wait till the last minute. The application is pretty dense, hopefully mostly with a lot of check boxes and not too much narrative, but it is not the easiest, of course, because it's HUD. Here we are. We look forward to your applications and to sharing those with the raters, and look forward to being competitive in collaboration with you all for this funding opportunity. Again, thank you all for your work and being present here today. Feel free to share the word that this recording is available after today to your colleagues in case there are other questions that come up or more information that you need to go back to. Thank you, everybody. Appreciate you all. All right, bye-bye.